the principles of resonance frequency analysis, as it's called, is a steady state swept frequency technique. So actually the frequencies used are in the audible range typically. They're not ultrasonic. It's about 5 to 15 kilohertz. The amplitude is so small that we can't hear it, we can't understand, or we can't perceive it, even in a transducer in a patient's mouth. It's steady state, so it's not pulsed. But most importantly, it is a truly non-invasive test method. It doesn't apply any stress to the surrounding tissues, to the bone, or anything. Unlike some techniques in dentistry, which rather bizarrely, the reverse torque test actually applies tremendous shear forces at an early stage of integration. And although it has its advocates, it is most certainly not and can't be considered to be a non-invasive test method. A transducer can be attached to the implant fixture to create the beam at any clinical site and any time. That's important because we want to be able to measure changes in interface, changes in stiffness with that time and how it evolves. So the third part is a quantitative measurement of implant stability as a function of resonance frequency. And lastly, a function of implant stiffness and marginal bone height.